Benvolgudes i benvolguts. Comencem l'acte amb la presència del molt honorable senyor Pere Aragonès i Garcia, president de la Generalitat de Catalunya.
Bé, molt bona tarda, molt honorable president, membres de l'ecosistema de salut de Catalunya i convidats de fora, benvinguts i benvingudes a aquesta presentació del projecte PRECISEU, que és el primer de les seves característiques que se centrarà en la promoció i implementació de la medicina personalitzada. És un plaer per mi, com a conseller de Salut, poder donar inici a un dels projectes que en clau europea intensificarà els vincles de col·laboració entre les regions per assolir en menys temps els objectius d'una medicina més preventiva, personalitzada i centrada en el pacient. The Government of Catalonia has firmly positioned itself as one of the primary hubs for healthcare innovation in Europe. The Government of the Generalitat has made a strong commitment to research and innovation, and the Department of the Health plays a particularly and crucial role due to its significant influence and transformation capacity. Innovation is a strategic driver for advancing the transformation in the healthcare sector. The rising prevalence of chronic conditions, infectious diseases and genetic disorders pose challenges that the healthcare system must address by integrating new therapeutic strategies with a direct impact of people's health and quality of life. The healthcare landscape is rapidly evolving, driven by the promise of personalized medicine, an approach that aims to provide agile, customized, specialized, equitable and effective solutions to address the pressing health needs for the population. Organization of regions across Europe is crucial for the development of personalized medicine. Coordinated efforts are necessary to facilitate the implementation of personalized medicine. PRECISEU aims to take the challenge and barriers hindering the integration of personalized medicine into health systems, collaborating with the key regional stakeholders. PRECISEU will provide regional ecosystems with European connectivity and address the significant and urgent needs for these regions. PRECISEU will contribute to the alignment of regional, national and EU-level policies and funding instruments. Catalonia, as a prominent player in the European healthcare innovation landscape, positioning itself as a hub that fosters innovation capacity and talent development among entrepreneurs and researchers. We work on improving the quality and sustainability of the system with value-based innovation, digital transformation, training of experts professionals. Thank you all for your participation and contributions in this meeting. I am looking forward to our continued efforts in making healthcare more accessible and equitable for all. Tot el meu suport en la consecució d'aquesta gran oportunitat, com és el projecte PRECISEU, que de ben segur serà l'inici de col·laboracions futures, fomentant la capacitat innovadora i el desenvolupament de talent d'emprenedors i investigadors. Moltes gràcies i benvinguts a Catalunya.
Good afternoon, everyone. My name is Jekaterina Novikova. I'm Deputy Head of Unit of Access to Finance and Innovation Policy in DG RTD. And this is my pleasure to welcome you here and, of course, congratulate you on to be pioneers in our initiative on the Regional Innovation Valley with the successful conclusion of the grant agreement as the first ones among other calls for proposals. I hope you see me well and you hear me well. I'm here also besides congratulations, passing the congratulations to you, all of you. I'm also here to tell you a little bit about the most recent developments in the innovation policy, also putting the regional innovation valleys a little bit in the context of the current developments in the EU policies, and to describe a little bit the next steps that we are planning on our side in order to support you and other regional innovation valleys in the future. I would kindly ask to put on the presentation. And probably we can go to the next slide. And one more. And of course, the regional innovation valleys, it is a part of the new European innovation agenda that has been launched in 2022. Not so much long ago, but actually it seems as a long time because it had been since a lot of the political and geopolitical developments in Europe. When we launched the new European Innovation Agenda with the 5 flagships and 25 actions, we actually were looking on the main challenges that Europe faced and how we can overcome it to make a strong and flourishing innovation ecosystem in Europe that would motivate the SMEs, the companies, the industry, the researchers and innovators to stay and prosper in Europe. As you see, the 5 flagships that had been defined probably will have a good resonance in your hearts because you all recognize these challenges. Either it would be funding for the deep tech scale-ups and also the scaling up problem in Europe to helping the innovative companies really to scale up quickly and having adequate finance to raising adequate funds in Europe and not without the need to go to the foreign markets. Of course, the enabling deep tech innovation through experimentation spaces and public procurement. And here again, talking about the use of potential of public procurement by procuring innovative solutions and thus stimulate innovative industries in Europe. Of course, accelerating and strengthening innovation in European innovation ecosystems, and here particularly also addressing the innovation divide that we have in Europe, and fostering, attracting, and retaining deep tech talents, again, promoting and helping the talents to grow and stay in Europe. All that coupled with improving policymaking tools, would it be coming to the definitions, would it be coming to the definitions, would it be coming to also stimulating member states to speak and exchange with each others through the EIC forum, European Innovation Council forum, or would it be through the different technical support instruments that we are providing to the member states, again, to rethink and improve their innovation policies. So we are now 2 years since the launch of the new European Innovation Agenda. We have completed more than half of these actions, but again, the work is ongoing. What is important, of course, that immense support that we have received from the sides of the member states. More than 200 actions had been declared by the different member states in support of the new European Innovation Agenda. And then, of course, I'm coming now to the key flagship, why we are all here together. Here it's flagship 3 on addressing the innovation divide and strengthening innovation ecosystems. And there, one of the actions, it is the Regional Innovation Valleys Initiative, and you are now part of it. So we can go to the next slide, please. And again, once we are talking about this framework, it is, we are still on the previous slide, apologies. We are talking about the ambition of the European Commission to invite the regions to connect from the regions with the different levels of development, from the less and more innovative regions. the regions working on the deep tech innovation on the 5 burning challenges, and of course, including in health and digital, as you are part of it, and also to collaborate on development and deployment of innovation through interregional projects. We are coming now at a very important point of this initiative because we have identified around 150 regions in the member states that are actually, we believe, are up to the challenge. And if we go to the next slide, and okay, so sorry for that. We are still, if you go to the precedent slide, because we a little bit not synchronized. Yes, this is the slide. So again, just to repeat what we are looking for the Regional Innovation Valley, what does it mean for you to be Regional Innovation Valley? We are actually trying to promote coordination and directionality of the region's research and innovation investments and policies to support the key innovation priorities. We want regions worked very much in complementarity on the smart specialization areas that had been already identified with the most recent scientific and technological advances, and of course, hoping to produce a profound impact in the targeted application areas. As regards the innovative actions and interregional projects, what we are looking for there, we're looking for development of the new, altered or improved products, processes or services, including prototyping, testing, demonstrating, piloting, large-scale product validation and market replication. Next slide, please. And how we wanted to achieve it, I hope you see my slide. Yes, exactly, that is it. It was actually through 2 calls of proposals under interregional investment instruments, I3. Also, this initiative was supported by the Horizon Europe under European Innovation Ecosystem Work Program. You are part of the winning consortium of the project. And also there was another call for expression of interest that was not supported by the funding, but it also gave opportunity for other regions that maybe not necessarily applied to this call for proposals also to be part of this initiative, providing that they meet the criteria. Next slide, please. And this is my favorite slide because, of course, you see that a lot of territories in many member states, and I must say, for example, many countries like, for example, Spain, among others, were very, very active in applying and participating in this initiative from the very, very early stages. That, of course, results also on very dense map, particularly for Spain. And, of course, here on the map, you are seeing that 5 burning challenges, we have also quite a good distribution between the 5 burning challenges in which regions are committed to collaborate. There are challenges on circularity, on digital transformation, including cybersecurity, on improving food security, healthcare, and reducing fossil fuels reliance. But again, I would like to underline, as you know, also for your project, innovation works really on the interception of different thematics and different sectors. So we not always easy to divide them precisely to which burning challenge it relates. And of course, here you also see the colors and also reflection that we have regions that has different performance status, coming from strong innovation leaders to still emerging innovators in our initiative. Next slide, please. Again, through a little bit of statistics from the data that I have just mentioned to you. And again, I think you see that the pies are presented on the chart showing that there is actually very balanced approach and very balanced, let's say, level of applications and level of awarded regions through these burning challenges, but also per development category and per innovation category. So I think it also proves and it actually shows that the regions from different innovation performances are ready and happy to collaborate, and we really hope for very good results there. My next slide, please. And this will be my last slide. But just to tell you a little bit, to give you a glimpse about the next steps, because of course, for us, we have reached a very important milestones now with the announcement of these regions. Again, a small asterisk that all grant agreement has to be signed. Not all of them are. You've been the first one for EIE, for example. But of course, for you, the work just starting, but also for us, the work is continuing. First of all, of course, we need to sign all the grant agreements for EIE and I3 during summer. Hopefully, by the beginning of autumn, we'll be able to have really very stable and final list of regions who will be part of initiative. And of course, we're already working on quite a number of events where we also will hope to support you and also explore the next steps for the regional innovation valleys. Particular focus, of course, is on the co-fund. It's not surprising. You all know it. We also know it. It was not easy to secure 50% co-fund for these calls, particularly when we are talking about co-funding from the structural funds. So we are going to continue the discussion. We're going to continue to see what kind of measures we can put in place, and also member state can put in place in order to support easier access to the co-fund. And one of the meetings that are planned next RIMA meeting on the 18th and 19th of September in Brussels, this will be addressed, particularly problematic of the co-fund in the regional innovation valleys. Of course, I have no doubt that many of you will participate in the European Cities and Regions Week in October, 7th to 10th of October in Brussels. Again, there will be a special session dedicated to the regional innovation valleys, and the opportunity for all regional innovation valleys to meet in person, face-to-face, will be in December in this S3 community of practice meeting in Rimini on 11th and 12th December. In parallel, we also in autumn, we are planning for a big, let's say, matchmaking event to give opportunity already for existing regional innovation valleys, but also for the future interested parties for participate in the next call for the regional innovation valleys to meet, to discuss, and to exchange together in the online event, the one that similar to the one that we organized last year. And then, of course, I apologize for my voice. I'm just recovering, but maybe not so quickly as I wanted to. We are also working for the next calls under Work Program 2025. We still will have another regional innovation valley call. That's that is, let's say, confirmed fact under European Innovation Ecosystem Work Program, very similar than to one of 2024-23, but for a moment budgets are not known. We also will have the mirroring call under WIDERA Work Program, also Horizon Europe Work Program, in the amount of 25 million. We are just now also working very closely together to see how we can, better to ensure complementarities between these two calls, and also to provide a good guidance to the participants to which calls they should apply. And of course, very tentatively, we are also now looking for other opportunities for maybe with support of the clusters under Horizon Europe that could potentially also to provide more targeted regional innovation valleys funding opportunities for very specific sectors and thematics. So indeed, work is ongoing. As you know, the Work Program 2025 is aimed to be published only end of March next year, beginning of April next year. So there is still some time, but just for you to be informed, and that there are also going to be also other funding opportunities that we are envisaging for the regional innovation valleys and also for other regions and partners who are not yet been lucky to become ones. So I have a next slide just to thank you and to thank you for listening to me. I hope it was well, despite you were not able to see me. And again, the work is just continuing. And just from the Commission side, what I want to tell you, we are really looking forward. We are really interested to follow your developments and to hear about your results. Hear about the success stories, but not only success stories, also the challenges that you face on the way. Particularly as you are pioneers, I can tell you also we are particularly interested to hear about your experience by launching these interregional projects. So we really would like to know more and to be more engaged and to follow more about it, because for us it's also lessons learned and experiences from implementation from your side help us to design better next initiatives, both funding and non-funding ones. So thank you very much, and I wish you all the success in the next steps.
Thank you, Jekaterina, for your time in joining us today. It's been a pleasure having you and your words addressing us a little bit more of knowledge about the regional innovation valleys and the call. Honorable President de la Generalitat, Honorable Conseller, directors, authorities, friends and colleagues, it's a pleasure being here today. And I like to express the acknowledgement from Biocat and from all the members of this consortium to the government of Catalonia for this support, for being so decisively contributing to support the personalized medicine, supporting Biocat, the consortium, and being aware of the importance that personalized medicine has for the patients and for the future of the humanity. And this is time to talk a little bit about PRECISEU, like the international partners like to call it. For us, it's PRECISEU. Now, you're in Catalonia, and you start to learn a little bit of Catalan. It's PRECISEU, so thank you for that. This is a very happy day for us also, and I also want to thank again Jekaterina Novikova, because she's been very committed to the success of being this one, PRECISEU, the first project of this call to be already reaching the phase of implementation. And this is something that is unique, and it's also because of the partners that we have, the 25 partners of this project that are also very involved in the success of this story that starts today and will end, hopefully, in June 2024, or maybe later, and we will see. Can I have the next slide, please? So this is some figures about PRECISEU or PRECISEU. It's a 5 years project. It's going to be 22.7 million euros with a co-fund from the Commission, from the European Union. We will have the partners gathering 11.3, and we will have the Commission committing 11.3. That is very important because this is a huge commitment that the Commission has with the connection of European and innovation ecosystems, but also with some of the burning challenges that we have in Catalonia, in Europe, and in the world. And the health system is providing the answers to that through two pillars: health data and advanced therapies. This is what PRECISEU is about. It's empowering the personalized medicine implementation and connecting innovation ecosystems across Europe. This is the title of the project. This is the meaning of it. We're having these 25 partners from 11 countries, and we are very happy to have 10 member states plus Ukraine. And then we are also happy to have here today two representatives of Ukraine joining the kickoff meeting. And we also want to be contributing to the reconstruction of the health system of this country, because this is for the connection of all different levels of the European innovation ecosystems in Europe. And to do that, we will devote 11.6 million euros to fund companies, organizations, institutions that will advance the innovation on advanced therapies and health data, the implementation of personalized medicine in the health systems. That will happen by 2025, more or less, and we will have like 20 or 30 members of our ecosystems funded with the money, with the funds that we are gathering from Europe, but also committing ourselves. And again, the government of Catalonia has had a huge representation here, a huge commitment to make this advance for the future of health in Europe. Can I have next one, please? Just very quickly to tell you that this is a flagship project, and it's a flagship because it's unique. It's unique in the effort that it involves from the partners. That's why we are here. We're very happy to be in the home of the government of Catalonia, explaining that to our partners, but also to the members of our ecosystem. Because as Biocat, that are connectors of this ecosystem, that we've been doing this for 17 years, are also able to devote this support to the ecosystem to advance in personalized medicine. This is a flagship project because it's a very unique call for the first time, and the first wave of this call, addressing these challenges that have been defined in Europe as burning challenges. Jekaterina said that, but it's also written in every single document that you can read from the Commission in these days. And there's one special document that we will be following in the next 5 years. It's a strategic research and innovation agenda for personalized medicine. We are not the only consortium or the only partnership following this strategic agenda. We will complement the high level also in huge partnership called European Partnership on Personalized Medicine. There are some members of this partnership also from Catalonia and from other regions. But there's a small or big difference that we will very happy contribute to. This EP-Permet is mainly based on member states and funding agencies contributing to the advancement of knowledge on personalized medicine. We will be connecting regions and bringing these innovations to the market with PRECISEU. So that's the way we will connect the knowledge, the bench, and the bedside for the personalized medicine advancements in Europe. We will contribute to this 5P. It's, the future, and we've been saying that many times these days, when personalized medicine is a reality in the healthcare system, we will not talk more about personalized medicine, we will say just medicine. Because this is the way it has to be. The same treatment is not the same for everybody. The same disease has the same name, but it's not the same alteration for the body, for the organism. And that is why we need more predictive, more preventive, more personalized, more patient-centered, and more participative. Patient has to be empowered to understand their disease and how to work together with the healthcare system to improve the situation. And we have to reach that in shorter time. That is what PRECISEU is also about. And this is, like I said, a unique opportunity for Europe because we want to engage Ukraine also in this journey of 5 years. Can I have next one, please? Yeah. So who's in PRECISEU? We have 9 regions, 9 regional authorities. Catalonia, we are represented by 2 ministries, actually, the Ministry of Health, but we also have a representative from the Innovation Agency. We have Emilia-Romagna, Gothenburg region, Flanders, Crete, with Periferia, the agency, Northeast Romania, Baden-Württemberg, Sofia municipality, and Lithuania. This is important because the regions that are there are also receiving the regional label, the Regional Innovation Value label that Jekaterina mentioned. And this is also important because in some cases we have a NUTS 2, a NUTS 3. This means that different levels of regions are also sharing this label. This is very good because we have different systems, different levels of participation. We see that in the project as well. We have 5 innovation agencies, Axio, like I mentioned, but also Sofia Investment Agency, in Innovation Agency in Lithuania, BioPro in Baden-Württemberg, and Arter in Emilia-Romagna. We have one science park, which is acting also as an ecosystem itself. It's an incubator, science park in Salgerenska in Gothenburg. We have 6 clusters or ecosystem-like clusters, organizations connecting ecosystems, Biocat, also cluster in Emilia-Romagna, BioRN in Baden-Württemberg, Rivne in Rivne region in Ukraine, Imago Mol in Northeast Romania, and Medvia in Flanders. All of them are facing different challenges and addressing the question of personalized medicine from different perspectives: medtech, digital health, advanced therapies. That is what we're doing in this consortium. There's two large infrastructures, EATRIS. It's a multi-stakeholder infrastructure that has several platforms for advanced therapies, for data, to advance in the translational medicine to the patient. We have the Barcelona Supercomputing Center. You know that it's a powerful engine for Catalonia, for Europe, and also globally. We have one global pharma company, AstraZeneca, that recently just landed in Catalonia with a huge commitment, and we also thank their commitment in this project. One patient organization. It's important to have patients in a project of this kind, because otherwise how can we address the actual problems or the needs that the patients have regarding personalized medicine? And we have Plataforma de Pacientes. They are based in Madrid. We have one European Digital Innovation Hub. You know that this is a network across Europe of hubs that are supporting the digital transformation of all kinds of industries. And for health, these are very important. We have Disney in Romania also. And then we have one research institution, a strong research institution, a network of centers in Crete. It's fourth. It's based mainly in digital health. So this is a strong consortium with many capabilities. But there's one important thing that we wanted to highlight here is the different colors that we have in these dots in the map. And this means the level of innovation, the performance of innovation according to the Regional Innovation Scoreboard, a document that recently we celebrated because Catalonia went to a strong innovator just a few months ago. We'd like to see at the end of the project those dots also going a little bit different in color, that the innovation can spread around and be a little better for everybody. Can I have the next one? So, which are the goals of the project? First, we want to accelerate this adoption of personalized medicine of Europe. That is the most important thing that we can be committing today to do. But we will do that like connecting the innovation ecosystems across Europe. Different levels and different capacities and different types of organizations. But then also we want to transfer those practices that are good practices, that are best practices, to bring also models of innovation across Europe. Business models, it's very important in this aspect because you have to reach the market, like we said. Scaling up these technological innovations in the health sector, and then last but not least at all, funding companies and entities to advance, and this is the level of innovation, that how close are they to the market, the TRL 6 to 8 on health data and advanced therapies, medicinal products. So these are the objectives of PRECISEU, and next please. We'll do that following what the Commission has told us to do. This is tricky, but we managed to organize a consortium to be doing that in the next 5 years. We will be working in a consortium collaborative way. This is a coordination and support action with all those different actions that we have to fulfill. Market connections, market analysis, training, skills, capacity building, platform networking, but very importantly, we have to save some money, half of it, to fund at least 3, we will be funding 4, multi-beneficiary projects. That's why we said that we probably will be funding from 20 to 30 projects, entities or beneficiaries into large projects. We have to act like if we were the Commission with innovation action, typical innovation action of Horizon Europe. This is also tricky, but we will manage. We have a strong consortium for that. And these are the areas in which we will be also working, and of course it's always about deep tech to improve healthcare. Next, please. We will be working in this is part of every project. You have to divide the working packages and you have to assign this to people. And very willingly and very enthusiastically, the consortium will devote to work on health-related data, on ATMP's development, the market and the industry connection to that, with activities, with learnings, with best practices, with awards that we will be providing to the best practices again. And then we will do that in the 5-year time with this platform that will be serving, and please be aware of that, because this platform will be calling to proposals and calling to projects and calling to beneficiaries to participate in this funding. And we will support all the journey, these companies, these organizations. But we will train also on the needs that we identified at talent. Can I have next, please? I just want to highlight the strong commitment of Catalonia. We will have Biocat as coordinator. We are leading a couple of work packages. We will be launching this platform. We will be supporting with Biocat funding also some of those companies. We will be connecting to EU presidencies. You know, there's every 6 months presidency of the European Union. Then we will be connecting to that to prioritize personalized medicine and the challenges in Europe. We have the government of Catalonia, Departament de Salut, leading a work package, very important work package, the adoption of personalized medicine in the health system. And then they will be providing this access to ATMPs, reimbursement models, and also providing with a huge commitment, funding commitment, the companies and the organizations. Axio also will be part of the innovation support program. They will provide business models, workshops. This is their, actually their main, or some of their main capacities will be also brought to that project, and help desk and cascade funding support. And then Barcelona Supercomputing Center, reaching about the ethical, legal, and societal implications of this important subject, connecting also to the patient's data storage, interoperability for data. And then AstraZeneca is committed in providing business models, market analysis connection to their global hub, and also mentoring for consortia, among other capacities that will be shared. Can I have next, please? This is very quickly the machine, the expertise. We will do all that in 5 years, connecting stakeholders, analysis of markets, providing translation of good practices, and then funding these 4 large projects with many members of the regions participating. And next one, please. This is the timeline. In 5 years, preparation of the calls, they will be launched by 2025. We will have hackathons. Someone told me the first one will be in Barcelona, so be ready for that. Personalized medicine schools, training programs, awards, these events, mapping, and then a big infrastructure for stakeholders working on advanced therapies about regulatory models, sharing practices, will be also put in place to boost this implementation of personalized medicine in the systems of health. And again, the next, I think it's, well, just very quickly to tell you, that was said by Jekaterina already, 2 types of complementary calls. This is ours, 54 million euros provided by the Commission. The other 54 will be provided by the partners. And this is the new European Innovation Agenda. This is very important for us because it's really a flagship for Catalonia and for the regions participating. Next, please. And last but not least, this is the team that is available for you for any questions regarding this project in Catalonia, the team in Biocat, but of course, the team in the other organizations in Catalonia that will be happy contributing to the success of this project. Thank you very much.
Conseller de Salut, director del Biocat, representatives of all the regions, countries and institutions involved in PRECISEU. I want to welcome you to the Palace of Generalitat de Catalunya. This is the site of the Catalan government for 6 centuries. So we've been here quite a long, and we welcome all of you to our country. És un honor i és un goig acollir al Palau de la Generalitat la presentació del projecte PRECISEU de la Unió Europea, un projecte liderat per Catalunya, capdavanter a nivell mundial, que contribuirà a accelerar de forma decisiva la implantació de la medicina personalitzada a nivell del continent, perquè precisament creiem que aquest és el futur de la medicina, l'adaptació dels tractaments a cada persona, a cadascú de nosaltres en funció de les nostres necessitats. I Catalunya lidera aquest progrés en el que esdevé una mostra inequívoca del potencial del nostre sistema de recerca i coneixement i un reconeixement també a l'aposta estratègica que estem fent des de fa temps, especialment en l'àmbit de les ciències de la vida i de la salut. The speakers before me have already highlighted the incredible potential of the PRECISEU project, both in terms of research, knowledge, and innovation, and its impact on people's health, which is, after all, why this project came to be. But behind Catalonia's leadership of the PRECISEU project, there is also a very clear sign of our European commitment, of our pro-European outlook and way of understanding and participating in the project to build a stronger Europe. I have said it many times, many times. A nation like Catalonia aspires to be able to contribute to face the great global challenges with all the countries and regions of Europe, doing our best for the progress and prosperity of European society. And this, of course, is what we do with PRECISEU. By joining forces and working together with other European regions and countries. Projects like PRECISEU are the best example of why investing in science is the best way to improve people's lives. Because science, above all else, is a tool at the service of people. This is a vision shared with the European Union institutions and which ties in well with the regional innovation valleys to strengthen regional innovation ecosystems across Europe. The PRECISEU project that today is taking its first steps is the fruit of this outward gaze, is the result of this commitment to science and research. That is why I would like to thank the European Commission for the commitment and trust it has shown in the entire knowledge ecosystem of Catalonia, and for providing solid funding, or 23 million in 5 years, to make this project a reality. In these 5 years of research and collaboration that we now embark on, I am convinced that we will accelerate the adoption of personalized medicine in Europe, leading to more accurate diagnosis, better management of resources, and more streamlined patient care, reducing the fragmentation and inequality that exist in the European Union. Amb el lideratge del projecte PRECISEU, Catalunya es consolida encara més com un dels hubs de referència d'innovació en salut del continent. De fet, si hem estat escollits com a Regional Innovation Valley i també per encapçalar PRECISEU és per tot l'ecosistema que ja té Catalunya al voltant de les ciències de la salut i de la vida, que fa temps que suma tot el potencial de diversos elements que ens fan únic. Grans infraestructures com el supercomputador Mare Nostrum 5, que en el marc del Barcelona Supercomputing Center, que formen part del projecte, o el nou Centre Nacional de Teràpies Avançades que està en desenvolupament. En segon lloc, centres de recerca i grups d'investigació amb un nivell d'excel·lència a nivell global, que situen Catalunya en tercera posició a nivell europeu en highly cited papers si tenim en compte la quantitat de població. En tercer lloc, un ecosistema de més de 1.400 empreses que es dediquen a la innovació en salut de mides i estadis diferents amb grans noms globals que també aposten per Catalunya, com AstraZeneca, que alhora col·labora amb PRECISEU. Però també tenim institucions que fan que tot aquest sistema funcioni de manera harmònica i que enforteixen la col·laboració entre tots els actors, com Biocat, que serà clau en el desenvolupament del projecte i també és clau per la implicació de la màxima institució de Catalunya per part de la Generalitat. Des del govern hem apostat des del primer dia per impulsar, consolidar i fer créixer la recerca a casa nostra com un dels sectors estratègics per avançar com a país. I hem dedicat esforços, molts esforços i recursos, també molts recursos econòmics, amb accions i mesures que han estat claus per al sector, que ens han contribuït a ser on som, en una posició privilegiada amb centres de recerca d'excel·lència, de reconegut prestigi internacional, amb un talent absolutament imprescindible i inqüestionable dels investigadors i investigadores dels centres i instituts de recerca i universitats del país, amb l'atracció cada vegada de més empreses que aposten per situar les seves seccions de recerca i innovació a Catalunya, amb la mirada inequívocament posada en la transferència de coneixement i amb un suport institucional des del Govern de Catalunya, però també des d'altres institucions, que només, i no és poc, però només busquem fer realitat tot allò que la ciència és capaç d'imaginar. Vull agrair a totes i a tots els que avui sou aquí i els que ens estan seguint per fer-ho possible. Gràcies per situar Catalunya al capdavant de la recerca en les ciències de la vida i de la salut i per fer possible que liderem un projecte europeu tan transcendent com el projecte PRECISEU. Estic absolutament convençut que la col·laboració amb centres de recerca de diferents territoris del continent ens permetrà donar el millor de cadascun de nosaltres, ens aportarà nous punts de vista i noves maneres de treballar i culminarà en un abans i un després de la medicina personalitzada a nivell europeu. Per tant, molta sort i endavant amb el projecte PRECISEU. Si iniciar-lo ja és un gran èxit, dur-lo a terme serà un canvi de paradigma en l'atenció sanitària de totes i a tots. Moltes gràcies a totes i a tots. Thank you very much i enhorabona per tot el que ha de venir. Molt bona tarda.
Okay, thank you everybody, and welcome to this session after the coffee break. We are going to work in two panels. The first one more related to the general framework of the regional innovation valleys concept, and the second one more related to the personalized medicine topic. And here I would like to thank you, Biocat, to invite me to moderate this session. And also, as you know, apart from this public event, we are in the two-day kickoff meeting of this project. We are working together with all the partners in discussing, analyzing the first step of this project. And it's going to be very interesting and very challenging because it's a big project, big budget, lots of partners, so it's going to be challenging. But I think that we are going to do our best and to return the trust that the Commission has put on us. This panel is named and titled Unlocking PRECISEU Potential, How Regional Innovation Valleys Drive Growth. And here I have together with me speakers that are very experienced in managing, leading technical teams, institutions, regional agencies from the different regions participating within the project, and ranging from different type of backgrounds and expertise, having PhDs, having MBAs, expertise on evaluating European Commissions, managing even healthcare systems. So I think this is the perfect cocktail of knowledge to bring to you an idea of what this can be and how it's going to be the impact in our regions. Okay, so I will introduce themselves a little bit. So the first one is Jekaterina, who is head of life science from the innovation agency in Lithuania. Then we have Angelica Laterza, project manager of the Unit for Research, Innovation and European Network in the Emilia-Romagna region. Then we have Ramon Maspons, Chief Health Innovation Strategics from the Department of Health of the Government of Catalonia. And finally, we have Katerina Rozocki, who is head of the Entrepreneurship Development and Innovation Unit from the Crete government in Greece. Okay, so the dynamics of this session is going to be quite simple. The idea is to work without slides and presentations and to do a first statement for each of the regions and then some questions from ourselves and also for the audience if it applies. So the first statement is going to be, please, 3-4 minutes maximum about your role, the role of your institution within the project, and what do you expect from this initiative and the impact in your region.
Thank you very much for your kind introduction. So I'm privileged to be leading life science department at Innovation Agency Lithuania. We love to call ourselves one-stop shop for innovation. So we support businesses throughout their journey from the day one, then researchers decide maybe this idea is maybe worth commercializing, till the day they decide they need to go to bigger market and to export, because we export actually 90% of what we produce in Lithuania. And we support our ecosystem in all ways, and we fostering and facilitating a collaboration. So I am your person if you need to do business in Lithuania, and if you need to buy data sets, if you need to connect to some scientists, I'm here for you. All you need to know is to know my email, pretty much. So we are also very honored to host one of the biggest life science events in Baltics, and I cannot miss the opportunity to promote it a little bit. Please save a date. It's in September 2025 in Vilnius. Very much worth coming to. We also establishing collaboration platforms. We make sure to establish very effective matchmaking for businesses, to connect businesses and scientists, because, well, I'm sure you know that for thriving ecosystem in life sciences, all you need to be on the same page, business, academia, and government. So we have that in Lithuania, very happy for that. And yeah, that's pretty much and actually we are very lucky and very happy and very thankful to Biocat to be leading work package 3. So we are going to connect, which is pretty much everything we do right now within our ecosystem, and we will be more than happy to do it between regions here and make sure we all, because in Lithuania we have 2 regions actually very different in innovation advancement. The capital one is a strong innovator, and the western and central Lithuania is moderate innovator. So we also have this internal goal, to make sure it's different color by the end of 5 years. So that's pretty much it. Thank you.
Thank you. And what do you expect from the project for your region?
Well, I expect I expect what we stop calling personalized medicine. We just call it healthcare, like normal. Because it's 5 years, that's a lot of time. Let's admit that. I mean, we started implementing some personalized medicine in Lithuania from 2006. So it's a lot of time already. Currently, there are known 40 groups of scientists already working on personalized medicine solutions on different levels. So we have no excuses not to make it some normal practice within 5 years. Currently, of course, there are issues with reimbursement, I guess, like everywhere, but we already have some medicine reimbursed. So my hope is in 5 years, we have at least 20 therapies reimbursed by our government, and our people have no idea what is generalized medicine anymore.
Mm-hmm. Perfect, thanks.
Okay, thank you. Good afternoon to everybody. As Javier correctly said, I'm Jekaterina and I work for the regional government of Emilia-Romagna in Italy. Our participation in the project is on two different sides, meaning that 2 different general directions are involved in the project. The general direction who deal with health, the health sector, in particular the unit dealing with innovation in the health services and the ICT unit, and then another general direction, which is the direction in which I work, which is the direction dealing with knowledge, research, labor and enterprises, and which is the direction as managing authority of ERDF and ESF funds, and also responsible for the implementation of the smart specialization strategies. Of course, we will collaborate together. The health general direction will be more involved in the core collaborative actions, while the direction in which I work will be more involved in the joint interregional calls, and so the financial support to third parties. And from Emilia-Romagna, in the PRECISEU projects, there are other 2 partners, our ARTER, which is our regional innovation agency, which has, among the other, the main role to coordinate our regional research and innovation ecosystem. And also the cluster in the health sector, which is one of the main actors of our regional research and innovation ecosystem, dealing, of course, with the health and wellness fields. What we expect, thanks to the participation in the PRECISEU project, of course, we strongly believe that thanks to our participation in the project, our regional ecosystem and the actors of our regional ecosystem will benefit thanks to the synergies, the complementarities, and the links that will be set up and developed thanks to sharing skills, competencies with the other regions. We strongly believe that our regional ecosystem the openness of our regional ecosystem towards the European networks or partnership will encourage the possibility to facilitate the collaboration of our firms, our startups, our research center, in order to develop more their skills, so to learn from the other actors, from the other similar actors in Europe. Of course, looking to the specific objectives of PRECISEU, and so the health sector, of course, the collection of, we recognize the importance of the collection of data in this sector and on the personalized medicine in particular. And we know that in this way, sharing the skills in this field will allow to the regional governments also to improve our investment and policies in the future years. So we hope to be successful in this kind of actions, of course.
Okay, a lot of outcomes.
Yes.
A lot. Okay, thank you. Now, Ramon, please.
Yes, thank you. With PRECISEU, we are facing a challenge as Catalan Ministry of Health, a challenge related with landing some strategies. First of all, for the last 2 years, Catalan Ministry of Health promote, with the coordination of Biocat, a new strategic plan, mainly focused on adoption of innovation. So the last 2 years working on adoption of innovation plan. Then for the last year, the Catalan Ministry of Health also lead a definition of a new personalized medicine strategy, and at the time launch a new ATMP program. So adoption of innovation, personalized medicine, ATMP, a new program. So PRECISEU is giving us the possibility to addressing all the challenges related with these different strategies and landing as a real experience the 3 strategies. We are extremely committed with the project because we are taking advantage of all this experience related with adoption of innovation, related with ATMP strategy, related with personal medicine, but at the time we are also taking advantages of our experience related with procurement of innovation tools and schemes. 2 years ago, European Innovation Council award Catalan Ministry of Health and Aquas with the award related with best European strategy related with procurement of innovation. So, taking care of these 3 strategies, taking care of this experience, what we are expecting? We are expecting with the project to support the improvement from a global view, at least 2 points. To support the improvement of assessing maturity and alignment of personal medicine innovation with system needs in order to easily adopt these innovations, and then to support the improvement of all our strategies in definition our real needs to promote faster adoption of these innovations. So bottom up and top down approach. And as a main sub-objectives related with taking care of all our experience related with maturity assessment of personal medicine innovations towards value-based healthcare adoption. Second point related with personal medicine pathways for clinical uses, clinical practices, and then reimbursement and procurement models for personal medicine innovations.
Great. So it's an instrument also not only to put budget on projects, but also to push forward your current strategy and improve it.
Absolutely.
That's good. Okay, thank you. And then finally, Jekaterina.
Good afternoon. I'm Jekaterina Rusaki. I work for the region of Crete. I'm here on behalf of our team in the region of Crete working on this project. I feel very lucky to be part of this consortium and to be here with you in Barcelona. We are a regional authority, and our main job is to implement the RIS3 Crete, the smart specialization strategy of our region. So we are mainly a policy maker, but through our work the last few years in implementing this strategy, we realized that there was a need for a specific unit within our region to support entrepreneurship and connect the different players of our ecosystem, businesses with research and academic institutions. We're very fortunate in Crete because we have 7 very important research and academic institutions. We're an island, but we still have a lot of research going on and important publications. So we set up this permanent unit to bring together the different players and also to map our ecosystem. And I'm also responsible for operating the Innovation Business Observatory. This is the name of our unit. Now, the project is very relevant to us, and we're very happy because it suits with one of our 3 specialization sectors of our RIS3 strategy, which is health and wellness. So we hope that this project will give the incentive and opportunities to our businesses in Crete to improve personalized medicine in Crete.
That sounds good. So we are talking about companies, but you put and hospitals, but you put some element very important to the table: the entrepreneurship and the talent. How important it's going to be to attract, to retain talent within the sector too. So, and
I would like to take the opportunity to help our cooperators, the Institute of Computer Science in Fourth Crete, because they support us through all this process, and we will work very closely together to achieve the best results for Crete.
Okay, thank you. So it will come the first question, and then you take the lead. So PRECISEU has 2 main blocks: the one that connecting, that doing some best shared practices and things like that, but there is the projects, and as Montse announced before, there will be big projects to be funded. What do you expect about this in your region? The response that you expect from the ecosystem, the innovation ecosystem from the regions. What do you expect from that?
Can we?
Yes.
Okay. From our side, I can say that for sure we expect that there will be a great participation from the private sector, first of all, because the idea is that we believe that it will be important. This kind of project of joint interregional project will give the possibility to the innovators to bring their ideas directly to the market. And so facilitating the collaboration between the private sector with also the research, the innovation centers, and so on. So we expect that there will be a great participation in this sense. Also because, as I said before, we believe that innovators and the innovators, actors of our regional ecosystem are aware about the fact that participating in a joint interregional project will give to them the possibility to learn thanks to the synergies and the collaboration that can be developed and encouraged thanks to this kind of joint interregional projects.
Perfect. And in the other regions, any
additional? I think Lithuanian ecosystem will be thrilled, to be honest. Well, we have very much growing ecosystem currently. We are growing 33% every year. So it's really active, and we have this power due to really good planning. And yeah, we have still 1 year to prepare and make sure, because we are also in charge of grant programs in Lithuania. So we'll make sure it's also aligned with those calls, so our companies would be ready, and the pipeline would be pretty already to make sure we meet the requirements and the readiness levels and so on and so on. And it's really good stage we are going to cover actually in this cascade funding, because it's TRL 6 to 8, which means you are about to go to market, which means it's easier to speak to private investors after. So I think our ecosystem is very much anticipating, is looking forward, and I'll make sure they are ready to do it. Because our infrastructure is growing also very much, especially in Vilnius. I'm not sure, but probably you have heard there is the BioCity. It's 7 billion euros project, which is has ambition to become the biggest innovation in life science hub in Europe by 2030. So it's pretty big infrastructure, and there somebody needs to work there.
Yeah, sure.
So we are very much looking forward.
Thank you. Any other?
Yes, just to add some idea, I agree related with grid participation for sure, but at the time, at least from our point of view, in Catalonia we have a wide and a strong experience in public-private partnerships. So maybe the main weakness is related with the sophistication of these partnerships. So we expect great participation, but with challenging and sophisticated proposals and projects coming from companies, coming from institutions, within a framework with some environmental challenges related with European health data space, related with new regulation framework. So we expect all these different issues using PRECISEU as a lab for testing all like a stress test of how we are facing all these challenges.
Yes, and also because most of you said that there will be a lot of participants in this course, and maybe we have to find some complementaries with other lines, other calls, and also you mentioned before the connection with the IS3 implementations, and also there are elements, for instance, the ESDF funds. So how is going to be this connectivity with so many elements apart from the project itself that the Commission is requesting us? What is the challenge here, and what do you expect to overcome it from your region? It's a good one, eh?
Yes, it's a good one, and it's not easy. You know, for example, in our case, in Emilia-Romagna, we will use the ERDF funds. And okay, now we have already started this year to test in some way a sort of a joint interregional project for other sector, ones in the blue economic sector. Emilia-Romagna participate in the so-called sustainable blue economy partnership just last December, and in February of this year an open joint call was launched. It was also in the Horizon Europe program. This partnership is part of the Horizon Europe program. So we at regional level has already launched a regional call in parallel to the European call. So we have started to test this kind of joint interregional projects using ERDF funds. Of course, it's a regional call with a very small amount of resources, so cannot be compared with the amount of PRECISEU project. But also in this case, we have faced some criticalities or some problems, meaning that at the beginning it was not so easy to understand the rules, the synergies among the different funds. So it was not easy to to align the ERDF criteria and requirements with the Horizon Europe requirements. So, for example, we at the regional level, our regional committee, supervisor committee for the ERDF funds, had to approve this kind of new kind of regional calls. In order, otherwise we cannot publish this call. So it was not easy. So I think that for the PRECISEU project, it's important that from the beginning, when we will start in defining the joint interregional project, we have to better define from the beginning the rules and some kind of standards, common standards, because with different partners, of course, a different kind of funding will be involved, and so it will be not so easy to have a sort of complementarities among the different sides. So it's essential to start from the beginning, defining better the specific, to take into account the specific needs or specific criteria of each partners, of course.
I think that some of the partners from the project will be able to use this ERDF funds, and some others not. So we are going to learn from each other to make it possible for future equivalent initiatives to optimize the resources from each region. Okay, I think there is no more time. So the last question is for all of you, is because, well, now we have the project, and as a region we have a label. What do you expect from this level, from the Commission? Because, okay, we have the funds now, but maybe not, for sure, in some time we are going to spend it. And what do you think the Commission with this level should complement our project somehow? Do you have any idea about that, or let's see what happens?
Oh, please.
Not sure. I
can say something.
Yes,
for us, because this thematic suits perfectly with our smart specialization strategy, we are hoping to attract companies who want probably to work in Crete or bring their activities in Crete. So use it as a thematic attraction, all the precise medicine. So we'd like to build on it, do different activities that combine with each other and build around it.
Well, Lithuania is quite lucky actually also, because we also have identified health technology of one of our key areas of smart specialization strategy, and we've been implementing it for 10 years, so we are very much hope for some continuity of the project.
Sure.
Because it's
a starting point. We hope to have long-term activities in this thematic area for us.
Perfect.
Our S3 strategy is focused on transformative processes that reorient value chain business model towards sustainability, towards generation of shared value, towards new technology-based industries. But at the time, we are not using ERD funds related with PRECISEU. But at the time, we are being successful in using ERD funds for some transformative and very innovative projects related with health, related with digitization, and new applications for pathology, digital pathology, for managing stroke patients, for example. So today, this label is giving us the possibility, at least, to address two new funding tools like STEP. Right? So this is one of the big successful situations that we are facing once we are having this level of regional innovation valley. So we are not using ERD funds, but at the time we are having the possibility to launch some STEP initiatives.
So we'll make it somehow.
Yes.
Yeah.
Okay, so I would like to thank all the speakers and finalize this session. Thank you, everybody.
Thank you.
insights on how the regions can better manage this funding. They have requested me to, speak a little bit to you while they're changing the mics to one to the other. So I'm going to do that very willingly. But I also want to mention that we have several regions, and as for example, Javi was asking or was commenting to the panelists, there will be regions using ERDF funds, regions that cannot, because their operative program or operational program is already closed, or also because sometimes the authorities responsible for ERDF are different than the authorities that are going to decide on the innovation policy. So every region is different in that sense. One of the things that we have also challenged our consortium to do in the next years is also review a little bit the literature on that. There's some papers, and there's one paper also with people from CSIC participating, and I'm just talking in that direction because I also want to thank the presence of a representative of the Spanish government here today. There's a paper depicting a little bit the commitment of the different regions with personalized medicine. One of the things that we want to do also in this project is change this map that is being published because we want to see more commitment. We want to see that probably in 2027, with a new operational program, we see some possibilities on that regard. So this is something that we really want to push for. The other thing I just wanted also to comment is that I liked to see some of the things that the panelists said when Ramon said, okay, not only aligning the needs or the technologies to the needs of the system, but also aligning the way in which we identify the needs or improving the way we identify the needs. This is very important because at that level, every single system has their own mechanisms, and we want also to make sure that we can connect them all. Another thing that was mentioned was how to engage the different types of partners, and that's something that the reason why we are here today, sharing the space, our consortium with people from the system, and I'm looking now at people that are collaborating with us in different types of projects, this ecosystem, but the same thing will happen with yours, is because we want to make sure that these opportunities that we were explaining before are open to the members of the ecosystem. And an example is the commitment of the Spanish government, for example, with the PERTE, the next generation funds, for example, and having like strong support to the organizations that work on advanced therapies, how this can be connected to what we're doing on PRECISEU. Or for example, a partnership that is already ending, and those consortia, those groups that were working together, how they can enter in this new PRECISEU consortia. So this is something that we have all to figure out, but this is something that that's why we also wanted you today here, sharing the space with the members of our consortium, identifying potential partners. Jekaterina, you did a great job just promoting your Baltics event and your region. So Jekaterina is over there with the mic. But no, you're already here. So that's the thing. The thing is being together here, identifying potential partners, seeing how your partnerships are going to end and how you can join the new partnerships. And for us, for PRECISEU, is exactly the same. So I don't know if we have already the next panel. It's going to be moderated by Núria Radó. She's also a member of Biocat's team. And this is going to be about personalized medicine. You have already the names of the panelists. So Núria, please, the floor is yours.
Bona tarda, good afternoon, everyone. So let's move now to the last part of this event, talking about personalized medicine. First, let me introduce the four experts we have here, even they don't need an introduction. But Toni Andreu is the scientific director of Beatrice, the European Infrastructure for Translational Medicine, and a partner of PRECISEU, as you prefer. Toni holds an MD and a PhD in biomedicine, and he's a specialist in the genetics and genomics of rare disease. Hi, Toni.
Hello, nice to be here.
Alba Jané, she's a biologist and holds a PhD in biomedicine from Pompeu Fabra University. She's currently the Life Science Scientific Coordinator at the Barcelona Supercomputing Center, and also, again, a partner of PRECISEU.
Thank you, Nuria.
Welcome. Josep Samitier is the director of IBEC, the Institute for Bioengineering of Catalonia, and a full professor in the physics department at University of Barcelona. Good afternoon.
Good afternoon.
And last but not least, Gianni De Rico, who is the head of the project management office at the Toscana Life Science and also a vice chair of EPPermet. Allow me to remind you that EPPermet is the European Partnership for Personalized Medicine. Its aim is to improve health outcomes within sustainable healthcare systems through research, development, innovation, and implementation of also personalized medicine. And we are very excited to have you here because, as Montse said before, we have taken into consideration as RIA and EPPermet agenda to build our project, and we expect and we hope to work together in the next years. So, and as Montse said, my name is Nuria Radó, and I'm part of the Biocat team coordinating PRECISEU. So let's start. As an introduction, and in 2 minutes, please, can you explain what's your role and the role of your organization in personalized medicine?
Okay, so thanks, Nuria. Anyway, very happy to be here. I'm very happy to be part of the PRECISEU journey. So EATRIS is the European Infrastructure for Translational Medicine, one of the research infrastructures created by the European Commission and the member states that wants to create a strong network of scientific facilities across Europe to serve the scientific needs of the European ecosystem. So we represent a network of about 150 research institutions that work in the area of translational medicine in 14 European countries. Spain and Catalonia is specifically present there. And our role is provide services and create new tools that have the specific aim of accelerating translational medicine in Europe. And because translational medicine, understood by the process by which the knowledge generated by science creates, after a long, shaking and bumpy journey, a specific solution for health needs, we strongly believe that personalized medicine is at the core of the translational medicine value chain. So we've been working in several personalized medicine actions across Europe, and our role is to create a network of scientists that are going to put the right knowledge and are going to create the right tools for the development of these interventions. Specifically, we have a focus, and I mentioned this morning today during the meeting, on for me is the paradigm of personalized medicine, which is the concept of the innovative therapies that are representing the individual solutions that provide the healthcare interventions for patient needs. In a nutshell, what we want to do is to work with the rest of the stakeholders that are necessary for making this value chain to work, to make sure that the knowledge generated by science is going to result, after a big effort of all the parties involved in this value chain, in something that is going to have a strong impact on people's life, making clear that at the center of this process we have the patients as the drivers of this energy to demonstrate that this is the societal responsibility of science. Just one little comment. This is a paradigmatic moment in the development of the scientific history in Europe. I think for the first time in human history, the capacity that science has to generate solutions is much higher than the capacity that the societies has to incorporate these solutions into societal processes. So this is a great example of an effort to go in this direction.
Thank you. Agree. Alba?
Yes, thank you, Nuria. Thank you, PRECISEU, for the invitation to participate here. So at the Barcelona Supercomputing Center, we are a public consortium of the Spanish government, the Catalan government, and the Polytechnical University of Catalonia. Our commitment is threefold. Our mission is not only to operate Mare Nostrum 5 and other clusters and high-performance computing facilities and to provide them for free to the international, European and national communities, but also to conduct science and to translate this science and this innovation into society. For this, we have, for the research part, we also have four scientific departments, the biggest one being the computing science department, in which more than 300 researchers conduct basic research on the development of the next generation of chip architectures, for instance, and quantum computing and workflows for high performance computing. And then we have 3 application areas, one for engineering, the wider areas of engineering, another one for earth sciences, where we develop models for climate change, for instance, that study climate change and climate predictions at the global level. And the one that I'm representing here is the Life Sciences Department. We're a 190 strong people department, most of all scientists and research engineers. And one of the biggest activities that we have also is the development of software infrastructures for data sharing, to enable data sharing in the future and in the context of the European health data space. And we do this in collaboration with several actors also present in the room, for instance, also in collaboration with IATRIS. These developments usually fall on the dark side of projects. They are not very visible, but we believe, and they are especially essential, because we are starting to pilot for specific use cases, for instance, on genomics within the genomics data infrastructure, with imaging health data within the UK project, also the more local level with the Datoscat project, which we are coordinating here with IBEC. And basically, this is the path to innovation. We believe that data is essential to conduct innovation in healthcare and in personalized medicine, and the work that we have been doing all these years and that we want to also action within the PRECISEU project is to pilot all these developments and to act on this data that is there, but that currently we cannot tap on because it's in different silos, and we need the technological solutions also to use it.
Thank you.
Okay, thank you, Nuria. So thank you, PRECISEU, for this opportunity. I am the director of the Institute for Bioengineering of Catalonia, the IBEC. This is a research institute, an interdisciplinary research institute at this moment with 23 group leaders and more than 300 people, working in the development of new knowledge and technologies based on bioengineering to develop new diagnostics and innovative therapies. So IBEC is committed in personalized medicine in different levels. First, obviously, in the research program. Our strategic research program for the next years is focused in 3 main aspects. One is bioengineering for precision medicine. The second is bioengineering for emerging and innovative therapies, and the last one is bioengineering for One Health. So this strategic plan has been supported by the Severo Ochoa Award very recently, so this is part of our activity. And one example of the activity that our researchers perform is in the last call of ERA-PERMED recognition of the best practice to apply to the practical personalized medicine was for one of our researchers that developed a complete map of mutations applied to Alzheimer's disease. So this is a system that can allow to define better and to distinguish the different patients. The second level of activity, this is inside of an institute, but the second level is in collaboration with the hospitals. So you have different plans at this moment with hospitals in Catalonia, working in personalized medicine, trying to accelerate the translation from the basic results to the practical issues, and also in collaboration with other 6 institutes that are in the network of the Barcelona Institute of Science and Technology. We are involved in a new building that will be located in the Ciutadella of Knowledge, focused specifically on personalized medicine. And perhaps the biggest one involvement at this moment is in the framework of the complementary plan. The complementary plan is an initiative of the Spanish Ministry of Science in collaboration with the regional government. And in our case, we are the coordinators in Catalonia and also at the Spanish level of the complementary plan in biotechnology of health. Specifically, this complementary plan is focused in the development of knowledge and technology for precision medicine. And in the case of Catalonia, that means that between 23 until 26, we will expend 15 million euros in different initiatives to develop platforms, to develop joint initiatives between hospitals and research centers to promote personalized medicine. And one of this initiative is that DataSCAT, that concerning data, but there are others concerning the development of new biomarkers or the development of new innovative therapies, for instance, based in RNA vaccines and nanoparticles. So these are examples of how IBEC at this moment is involved and also participating obviously in international networks.
Thank you. Gianni?
Good afternoon, everyone. So first of all, thanks a lot for the invitation. Congratulations for this amazing project. And I would like also to thank you on behalf of Toscana Life Sciences, which is the organization where I work for, and on behalf of the European Partnership for Personalized Medicine, especially from the coordination team. I see that our organization have a similar background. I mean, we are positioned between research, innovation, and market. So Toscana Life Sciences as well has been working since 2006 to accelerate the market uptake of science and innovation. We have been funded by all the Tuscany University and superior schools, as well as the Tuscany region. And we have been working exactly on this aspect at the beginning for the pharmaceutical industry, because we have a huge pharmaceutical hub in Tuscany, but then with all the industries, that medical devices especially, that needed support. Regarding personalized medicine, we have been involved on personalized medicine since 2016. We have been part of the update of the Strategic Research and Innovation Agenda. I myself have been very delighted to be the vice chair of the International Consortium for Personalized Medicine, and within the European Partnership, we are my organization and I am the coordinator of the work package, which is one of the pillars of the European Partnership for Personalized Medicine on interregional collaboration. We have always stressed the importance of the regional dimension in this process. We have been funded by the European Commission in 2018 with a project called Regions for PerMed, which exactly wanted to explore the role of the regions for the implementation of personalized medicine. Because regions, besides the funding activities, which we are most known for, has wonderful ecosystem, and Catalonia is one of these. We work closely with in Italy and Spain. We manage the healthcare system, so we are there to update the healthcare policies, to sometimes push healthcare reforms. So all these inputs from science, from innovation, from a policymaker had to be taken into consideration also when it comes to personalized medicine. So following the European project on Regions for PerMed, we decided to have the regional dimension as a particular focus in the European partnership. And it's not a case that it's the, I think it's the only partnership which has seen the participation of approximately 10 regions. I haven't counted them, but it's like the partnership with the most regions participating. Yeah, that's it. This is what we have been working on since the beginning of this movement.
Thank you. So you said a lot of things. You said facilities, scientific needs, health needs, innovative therapies, data, translational medicine, impact of research, patients. So regarding all these fields, regarding your areas of expertise, what are the main challenges to personalized medicine? And more important, how do you think PRECISEU can help overcome them? You can start.
I think the challenges have been the personalized medicine agenda in Europe, and the brainstorming has started 15 years ago, and organizations like IC-PerMed, ERA-PerMed, now the European Partnership and other initiatives had created a real agenda with a strong analysis of the needs, right? And we know that, for instance, the generation of evidence, regulatory acceptance of health innovation focused personalized medicine intervention, implementation in the context of use, sustainability are the real challenges. But what we have behind is something that I think Montse and also Jekaterina mentioned. Montse used a sentence flagship project for healthcare transformation. And you said, for me, personalized medicine will be the new normal. What we mean is that we have the ambition of transforming the healthcare system at all dimensions, right? And the challenge is the transformation of the strategy of the healthcare system. So that means that is something that has to be with the collaboration and the alignment of all the stakeholders that participate in that value chain. Personalized medicine is not just a challenge for the scientific community, for the industry, for the policymakers, for the patient community. It's a challenge for everybody. Actually, it's a challenge for the society and citizens as a whole. So what I think PRECISEU can do is to cover a gap that in practical terms has existed over the last few years in a moment where the development of the personalized medicine agenda was driven by the scientific community and had this difficulty in being brought to the innovation ecosystem and to the market. And I think we can provide, with the example of this community, proof of concept that we have the capacity of bringing the knowledge generated by science into practical interventions that can be transferred efficiently and with support to the equality access to the citizens in the context of the European health system. Gianni mentioned something which is very important, which is the role of the regions. For the development of a health strategy, of health interventions, the main driver in the European landscape, in most cases, is not the member state, it's the region, it's the place where things happen. So we have an extraordinary opportunity and a proof of concept to demonstrate that this is possible.
So I couldn't agree more with you, Tony. Actually, of course, we... Thank you. From the BSc side, we see more the science part, so it's happening in the science, and we see great pilots, especially in the area of rare diseases, cancer imaging or cancer genomics, great pilots in which we can show interoperability of the data and the use for very specific cases in personalized medicine. But of course, what is missing is this translation of these very specific use cases which work wonderfully at a very small level and translating them to a wider scale at the regional level, for instance, and also involving companies and the industry network, no, as a whole into those use cases that we have piloted. And when I say we, I do not mean the BSc. I mean all the stakeholders of the research infrastructures, also Elixir, and others, and all the institutions that form part of them that contribute and that have been working on this for over 10 years already. So it is time now, I would say, to overcome these challenges that we have been seeing for so long, to exit those silos in which not only scientists but other practitioners, clinicians, but also researchers in personalized medicine typically fall. These data silos, method silos, ways of working silos, and we need a little bit to break those barriers, which are not only technological, they are not only data, they are actually a socio-political kind of barriers that need to be broken and agreed, no, so that we can all work together. It's a big challenge, but this would be the right place to tackle it, I would say.
It has, if I can add, an inspirational element. Because I think we need to create this sense of identity that working together we can do things that individually we cannot even dream doing together. So this is the challenge that the development of science has put on our hands to demonstrate to the society that this wide scientific community, not only academics, but also innovation ecosystems, policymakers that participate in the value chain, can bring this to the citizens.
Great.
Mm-hmm. Yes, I completely agree with my two previous colleagues about that. And in order to focus in some aspects that, in my case, I know a little better. So some of the challenge I will try to divide in three aspects. No, some of the challenge in diagnostics is try to connect better all the biomarkers with the clinical data. So this is one of the main elements that at this moment is necessary. So more and more we develop new technologies that allow to obtain amount of data, an amount of information about biomarkers, but we need to collect that with the evolution of the patients and with the treatments of these patients. And this is one of the first challenges. The second is the development. For that, probably we need to develop better biomodels. So better humanized biomodels that allow us to analyze what will be the impact, the effect of therapy, and also the combination of therapy for a specific set of patients. And this is an issue that we need to improve in the next years. And my last consideration is concerning we need also to develop knowledge and technologies in order to facilitate the development of advanced therapies, in order to allow that these advanced therapies could be sustainable for the health system and could arrive to all the people. And this is a main challenge at this moment. At this moment, we have very new advanced therapies, very innovative advanced therapies, but the price of these therapies are very, very expensive, and we need to develop new process in order to perform that will be possible to arrive to all the people and to arrive to all health systems.
Thank you.
Well, it's hard to be the last one. Like they have already said everything. No, but I mean, of course, I also agree, especially to the part that regions are the engine of innovation and the core to translate the benefits to the patients. We have talked about patients, we have talked about citizen. I would just add one additional layer, which is one of the things that are really needed now. We have seen that we are capable of producing enormous amount of knowledge, tremendous amount of innovation. Now we have to translate this into solution, and I think that the next step, the next challenge for the European region is to have a more active role in clinical validation, in clinical studies. We have run a small study in Tuscany, and we have seen that where the hospitals, the regions are very involved in the clinical studies, we have tremendous benefit in terms of costs, in terms of access to innovative therapies, because those are patients that are treated so are offered better treatment opportunities. The doctors that are part of the study have a bigger career because they are able to publish in the higher level journals, and the companies that produce innovation, which sometimes are like spin-off startups, have less risks to develop innovation. So I think that the next challenge, and this is something that can be also targeted and tackled by the PRECISEU project, is to be more and more active in clinical validation, because clinical validation will make regions more competitive and will give to citizens better treatment options and diagnostic options.
Thank you. So, Gianni, this one is for you, and you can be the first one if you want.
Thank you.
So
they're too smart. They're too smart.
So, if you permit, and PRECISEU have common interests and have similar points of view. So, how do you think we can help each other? Yep. How can we work together?
So yes, I agree that we have a common ground. You have been referencing the Strategic Research Innovation Agenda. By the way, next year, in December next year, we will celebrate the 10th year anniversary of the first Strategic Research Innovation Agenda approved by the European Commission on personalized medicine. I mean, first of all, we have to connect, and we have a dedicated work package to do this. And there is one, as I said, there is one pillar which is on interregional collaboration. One of the main aims is to keep the activities of best practices, because this is a way where we can showcase where the innovation happens, where the best examples are. And this is something that we can definitely put on the table. We have also one work package, because usually as ERA Permed we fund basic and translational research, but now there is also a work package which is specifically targeted on innovation, so funding innovation. And I think that there can be synergies, because you will establish and launch call for proposal specific for that, and we will be doing the same. And I believe that the size of the projects that you are going to fund are the same of the ones that we will be funding on work package 3, which is on innovation, as I said. So I believe that through the work package 3 and work package 5, which is like the two main the two pillars of the European partnership, we can multiply the efforts. From our side, valorizing the work that you have been doing, and maybe you can valorize some of the work that we have been doing, the experts that we have collected, and the network that we have to reach a greater, let's say, aim within the activities that you will carry out.
Okay. I don't know if you have something to add to this. Otherwise,
I completely agree. So
okay. Otherwise, I have the last question, and just in one sentence. In 5 years, we're going. PRECISEU is going to an end. So, how do you see personalized medicine in 5 years? So, what do you expect to see solved from them?
In 5 or in 20 years? Okay.
Well, one sentence for each.
5 years, I expect to see real personalized medicine targeted interventions with the participation of the citizens, with all stakeholders involved, in a way that there is an equity access for citizens in Europe. This is what I expect.
Thank you.
So I would say, adding to that, I would expect after 5 years to see a full understanding of the value chain in personalized medicine from the innovation agencies, companies, research centers, and all contributors in the ecosystem, and to be able to evaluate actually all the steps in the value chain and which have been the pilots that have contributed to it and which fall or which we accept for the future European health data space implementation 2029, 2030
okay.
as a goal. But yeah, at least the understanding.
Great.
Yes, for me in 5 years, in addition to the previous expression of my colleagues, so that will be a change in how the health ecosystem is organized in order to include all the value or the chain values for health. So from the knowledge until the innovation. So we need to work more linked all together in order to fulfill all the challenges that the health in Europe require at this moment.
Okay, thank you.
I want to borrow a sentence from the former panel. Maybe in 5 years, and I think this could be feasible, that we will not be talking about personalized medicine. That the personalized medicine will be an actual, there will be actual treatment options for patients, and so we will be talking about something more, something else. But that is my wish for personalized medicine in 5 years.
Okay, thank you very much. I'm afraid we don't have time for questions, so sorry, but thank you all, and let's start working.
Yeah, thank you.
Okay. First of all, I would like to thank all our friends and colleagues from the bioregion of Catalonia for being here. Also, representatives from the Spanish government that came here because we are trying to coordinate the different initiatives in the field of the personalized medicine. As you see, during this session, there are a lot of challenges and opportunities to face together. Thank you, of course, all the PRECISEU's partners for coming to Barcelona. I'm sorry, but I have bad news for you. Tomorrow we're still working, so we have the second day meeting, but we will go in a couple of hours to the nice dinner close to the beach. I also would like to thank the government of Catalonia, all the ministries and agencies involved in this project, not only for the support and the commitment to PRECISEU, but also to hosting us in this nice and ancient building that is so special since the 15th century for us, for the Catalan people. As you saw during this session, this project aims to build bridges between the different agents of the ecosystem, also to connect the different initiatives that have already been developed in Europe, and not only from the region, but also from the states and the European levels. You saw that this project has the singularity, and I think that it was Tony that said before, that to cover few gaps that we have. There are a lot of academic and scientific projects that have been already developed, and we need to identify those results and those solutions and try to take the take this information and all we get from this project and put it here. It is also a project that is not composed by state governments and authorities at the state members levels, and this means that we are also covering this part at this level from the view of the regions. That this means sometimes that it's more deeply close to people, not to the healthcare system. I think that this is the way that we should try to not take the advantage of all that has been solved in other ways, but trying to fill this gap that at the end what we want is to allow to make more efficient the arrival of the innovation and these new therapies and technologies to the society, to the people. I think that PRECISEU, but also these regional innovation valleys, we have the challenge to demonstrate that Europe can only be constructed through the synergies and collaborations among regions. From our view, from this side, we can help to improve the European policies, helping to construct the Europe that we want. That is the Europe of the people, by the people, and for the people. So I think that we can complement the different strategies and initiatives that are being already developed. So for us, for Biocat, for me as CEO of Biocat, it's a total pleasure to coordinate this initiative. I always say that for me it's not a project. I think that it's a great adventure, and I think that after 5 years a lot of things will be created, and not only personal relations, but I think that a lot of dreams maybe will be a reality after these years. But it's proud for us having this unique opportunity. So thank all of you for this session, and just the show just started, so as show must go on. Thank you so much.
Stay here until the end of the session. Now it's, like we say, it's the end, but we will work, the partnership will work tomorrow. But now just enjoy Barcelona, meet the partners that or the stakeholders that are here around still from our region. Also say hi to the representative of the state government, because they are also in EPIPermet, and we have a lot of things to do together also in that sense. Thank you very much, and see you soon.
Generalitat de Catalunya, us agraïm la vostra presència en l'acte d'avui. Fins molt aviat.